Welcome to the OrthoNations Academy Total Knee Rehab Phase 1. This presentation covers the essential exercises and guidelines for the first phase of rehabilitation following a total knee replacement. In this program, we'll go through 4 phases of rehabilitation following total knee replacement. Phase 1 covers weeks 0 to 2, Phase 2 from 2 to 6 weeks, Phase 3 from 7 to 8 weeks, and Phase 4 extends from 7 to 10 weeks. Phase 1 of rehabilitation focuses on managing swelling and pain, improving gait, and restoring range of motion. The goal is to achieve 90 degrees of flexion and less than 10 degrees of extension during this period. Let's now go over the exercises that are essential during Phase 1 of recovery. These exercises are designed to improve range of motion, strengthen muscles, and support knee function. The exercises include leg elevation, leg elevated ankle pump, quad sets, leg elevated heel slide, forward stepping, and bag hangs. Leg elevation is a key exercise to reduce swelling and improve circulation. Elevate the leg with the knee flexed between 30 and 90 degrees. Perform this for 10 to 20 minutes, 3 to 5 times per day, during weeks 0 to 4. Leg elevated ankle pumps are important for maintaining circulation and reducing swelling. While your leg is elevated, point your toes down and then flex them up towards your shin. Perform this motion continuously for 2 minutes. Repeat this exercise 3 times per day to promote blood flow and prevent stiffness. For quad sets, tighten your thigh muscle, pressing the back of your knee down into the surface. Hold for 5 seconds and repeat for 2 minutes, 3 times a day. This exercise reactivates the quadriceps muscles, essential for knee stability. Quad sets can be done with the leg straight on a flat surface, or with the leg elevated to assist in managing swelling. While lying down with your leg elevated against an inclined surface like a wall or an inclined table, slowly slide your heel toward your hip to bend the knee. Hold the position for 10 seconds, then slowly extend your leg back to the starting position. Use a towel, dog leash, or strap for assistance if needed, and your unaffected leg can help guide the movement. Perform this exercise for 2 minutes, 3 times per day. Additional notes. Video 1 demonstrates this exercise in a rehab clinic setting, while Video 2 shows how to perform it at home. As part of Phase 1 gait training, forward stepping is important for restoring proper walking patterns. Begin by stepping forward with the leg that had surgery. Place your heel on the ground first, keeping your toes lifted. Then lower the rest of your foot flat onto the ground in a tapping motion. As you do this, relax your knee to allow it to extend. You may feel a gentle stretch at the back of your knee. Repeat 30 times or continue for 2 minutes. This exercise helps improve walking ability and assists with straightening your knee during movement. This exercise is a progression from Gait Training Part 1 and should be started once you're comfortable with the previous exercise. After placing your heel and foot flat on the ground, press down firmly through the ball of your foot. Shift your weight onto the leg, ensuring your knee stays straight by tightening your thigh muscles. Hold this position, with your knee directly over your foot for a brief pause, then return to the starting position. Repeat this movement for 30 repetitions, or continue for 2 minutes. Perform this exercise 2 to 3 times per day to further improve knee stability and strength during walking. Bag hangs are a gentle, gravity-assisted exercise to help improve knee extension after surgery. You can do this exercise at home with either a strap and weight or a backpack. To begin, sit comfortably with your leg elevated on 2 chairs, fully supported. If you're using a strap, place it around your leg so one part rests above your knee and the other below, avoiding any incision areas. Attach a small weight, between 1 and 10 pounds, to the strap so it hangs below your knee. Let gravity gently straighten your knee and hold this position for 3 to 5 minutes. Alternatively, you can use a backpack. Slide your leg through both straps, placing one strap above your knee and the other below. Add 1 to 10 pounds to the backpack and let it gently help extend your knee in the same way. Whichever method you choose, try to hold for 3 to 5 minutes, and aim to repeat the exercise 3 to 5 times a day. Remember, this should feel like a mild stretch. If it's too intense, simply reduce the weight and gradually build up as you feel comfortable. In Phase 1, the following exercises are crucial for rehabilitation. Leg elevation for 10 to 20 minutes, 3 to 5 times a day. Leg elevated ankle pump for 2 minutes, 3 times a day. Quad sets for 2 minutes with a 5-second hold, 3 times a day. Leg elevated heel slide for 2 minutes, 3 times a day. Forward stepping for 30 repetitions or 2 minutes, 2 to 3 times a day. And finally, bag hangs for 3 to 5 minutes, 3 to 5 times a day. Before moving on to phase 2, make sure to check in with your surgeon or physical therapist to ensure it's appropriate to progress. After that, watch the next video to learn about phase 2 exercises.